Good evening, everyone. Good evening to another episode of Let's Put It Fair. I want to thank you all for coming around. You know, the week has been kind of very busy for all of us, and I really want to trust God that we've been fine and safe. First and foremost, let me appreciate you all for your support so far since the beginning of this project, and for all. And most especially, let me thank you all for your inputs, questions, and all. It's been a wonderful time with you. And today's another time that we'll have again to come together as friends to look into matters that concerns us. And today, by the grace of God, we'll be looking into a very serious one. I want to promise you that it's kind of very serious because give or take, the world, the society has been shaped to a new method of living. And there is no way we can shy away from the fact that so many things are happening now that wants to look like it's not the normal way that we used to do things. And promise me, today we have in the house with a professional in the field who will help us to dissect and look into critical and give us answers while we look into the critical issues surrounding this new way of living. My name is Adebukola. Once again, I welcome you. Please, if you are online right now, you can share this video, share it around with your friends, and let's bring everybody together, because what we're talking about today, it will help you, will help me, and we need to know it. First, you need to like our page. Just click on the like button so that anytime we have a live video like this, you will get notification for it. OFE TV is also on other platforms. OFE TV is showing on Facebook, on Instagram, and on YouTube at official OFE TV. So on Facebook, you like our page. On Instagram, you follow us, and on YouTube, you subscribe to our channel. I want to once again say you're welcome. Today we'll be looking at a very important, very critical issue, like I told you, and bet you I have professional who can help us dissect this. But let me introduce you to the topic. The topic we'll be looking at today is the impact and the influence of coronavirus pandemic on our health system. My friends, I don't need to introduce you to what coronavirus means. We've been introduced, or we are already getting used to it since the pandemic started about 3 months back. And looking at the way it is, whether you like it or not, you must abide by the rules of the government, follow the trend so that you don't get caught by the virus. And the virus is not just virus, it's called pandemic. I know when you hear the word pandemic, it's a very serious issue that we all need to take very serious, like I said. Now, coronavirus came into Nigeria, our own space, sometimes in February ending and March. But the code for coronavirus is COVID-19, which means that the virus has been around since 2019 and we don't know anything about it. Maybe the virus has not found its way into our nation, but now the virus is here. And since March till now, June, so many things has happened. The last count, there are so many people, most especially in the Lagos space, that are victims of this virus. Let me rewind it a little bit back. When this virus came in, some people did not even take it serious, because the gist about how the virus came into the nation was not looking like real to us. And we were not taking it serious, but the government had to compel us to obey the rules, stay indoor by force, and don't get caught into this virus and into this pandemic as a whole. But news of big people, prominent people, big and small, like I would like to say, have been dying of this virus. And some people like me and you will say, okay, it's a virus for the rich. But my friend, this virus is not looking like the virus for the rich anymore. It's not the virus for both the rich and the poor. But now, since the virus came in, our health sector has been reshaping. And people have stopped going to the hospital. So people are afraid of going. Some will say, even if I go, they will say I have COVID-19. That is why I will not go. And we've settled to so many solutions on ourselves. And you know, give or take, this may be looking like it's cool for us, but it's not really cool because it has been affecting us psychologically, health-wise, and in every way. That is why we have this topic to look into, and that is why, with a very serious humility, we have in the house tonight a professional who is not just a doctor, but these are the people who are keeping the front line for us, who knows in and out of this, and that is why we would like to encourage you. Share this video to show everybody. Let us gather around. Let's hear from. Let's have a chat with somebody who is an inner. So if you have any other questions in your mind, begin to prepare your question, because I promise you have somebody in out that can give us real answers to all our questions concerning the pandemic and how it has affected and influenced our health sector. Please permit me to welcome, first to introduce our guest and welcome him to this episode of Let's Keep It OFE. Ladies and gentlemen, welcome with me, Dr. Segun Alli. You're welcome, sir.
Yeah, thanks for having me. It's a great pleasure to be here.
When you hear Dr. Segun Alli, Dr. Segun Alli is not new to us. It's not new to so many people. But because of those guys who are coming in from some part of the world, I would like Dr. Segun Alli to introduce himself to us. Sir, who is Dr. Segun Alli?
Okay, Dr. Segun Alli is a young man, a youth who happens to study medicine. I finished from the University of Ilorin, and I presently work as a resident doctor with LUSUTH in Ikeja, Lagos. I'm infectious disease prevention and control specialist. I'm LUSUTH response COVID-19 response team. I'm part of the team in LUSUTH, and I work in the isolation. I supervise the isolation in LUSUTH as we speak on COVID-19. That's what Dr. Alli.
Doctor, thank you so much for coming.
All right.
Sir, let us go straight into the business of the day.
Okay.
The topic before us is the influence and the impact of COVID-19 on our health system. I want you to give your introduction to that. How has it actually affected the health system of our nation, sir?
I think I like your kind of introduction when you said this is a new normal. I mean, it's a reality that we must face, and we must abide and live by with the consequences that come with it. You know, we wouldn't say we are not so prepared, because even before 27th of February, we've had about China losing people, you know, the impact on China. So I expected that we will have been prepared enough before that 27th. Closure of borders, you know, economic impact on us and so on. But on the health sector, I must confess to you that it seems we are not so prepared. You know, we know the health sector is not as good as what we have wanted, but apparently, if we had, you know, stood up to our responsibility as a people, as Nigerians, as a government, you know, as a people, as health workers, as all of us, if we had done what we should do, the impact wouldn't have been so much. But I can tell you that, you know, the impact is so much. You know, people are dying. You know, we are confused. You know, the government is not coordinated. You know, the people do not believe the government. You know, probably rightfully so, but makes the impact so much on our system that if care is not taken, we don't want to know what can result from that.
Wow, doctor. You know, I'll try as much as possible tonight to ask questions that are on the street, questions that people need answers about. I will not be too formal. I want to ask the questions that people are asking outside there. Some people have already even concluded on this matter and they have their answers to the question. But thank God we have you, who is an in-house person, so that when you talk, they will have a new mindset about this thing. So let me first ask, is COVID-19 real?
I'll be so foolish if after going through what I've gone through in the last 1 week, I still feel that COVID-19 is not real. If after witnessing death arising from COVID-19, I lost a patient today, I lost a patient yesterday, I lost a patient 2 days ago, 3 days ago, I lost a nurse about 2 weeks ago. And the diagnosis of COVID-19 was made. If after that I still don't feel that COVID-19 is real, then something is wrong with me. I wouldn't want to talk so much about why people will not want to believe the government. Probably over time, government has failed the people. So government has had cause to lie to people. So probably and people do not trust the government. That they vote into power. So probably that's what is responsible. But, my message here tonight is, if you want to, feel that COVID-19 is not real, I hope you don't get it. Or any of your relatives does not get it. Otherwise, you appreciate that COVID-19 is real and is killing people.
Doctor, there is this question that people, it's already even on social media, on WhatsApp. He said, if you know anybody that COVID-19, please signify. And all the way, the reply or response is that I don't know anybody. I don't know anybody. But let me now ask, before I go to that part of it, is COVID-19 overhyped? Is it as deadly as the way don't touch, don't go out, no gathering,
okay.
Please?
Okay. I like that question, and I think that I'm going to be a bit, straight with my answer. The truth is, COVID-19 is not like Ebola. It's not as serious as Ebola, probably because it's milder. It's not as, as serious, as powerful as Ebola and other viral hemorrhagic fever, as, HIV, other viral infections, and the rest of that. It's milder. But the reason why this is more dangerous than all of that is that, the means of communication, the means of contracting the disease is quite different and is quite difficult to tell. Ebola, anybody that will transmit Ebola will be sick. You do not need to be sick to transmit COVID-19. The vehicle from one person to the other, is so significant that mere touching any surface that the virus in, you can get it. People, just like you said, that we've had COVID-19 at every forum, every social medium, and we are gurus in COVID-19. So we know all the pathophysiology of COVID-19. But the transmission is in fact much more alarming than others. You do not need to be sick. You pick someone from the bus stop, and he sits in your car. You're not sure you touch the car when the person leaves. You may be touching. You may contract COVID-19. So the person is not sick. As a matter of fact, I've told people that some people do not even have fever, because when you get to the bank, they put their thermometer on you, and to pick. And I say it is nonsense, because a number of people will be asymptomatic. That doesn't mean that they cannot get into the bank and then touch surfaces, and others will be infected via that. We've had that happen. And that is why we need to be much more careful, because now it is much more, easier to contract, than Ebola and other deadly viral infections.
Okay, doctor, now let me now go back to the scenario I was painting the other time. I want to quickly go through the statistics. As at now, Lagos Lagos as a state has in total over 9,741 coronavirus cases. In all, as a nation, we have over 16,000, if I'm right. We have over 15,000 cases. Now, the question now comes back. Do you know anybody that had coronavirus? Why do people still have that impression that this virus is looking like a makeup? And also, how do our government generate these figures every day? How do they do the contact tracing that there is no day that will not have at least over 500 figures?
Okay, I want to feel that government is even underreporting these cases, because probably because I'm involved in testing, and the diagnosis of COVID-19, and I can tell you that I received a result today amongst the health workers, and I can tell you that 20 people. Sorry, did I say 20 people? 20% of the number tested came out positive. I'm sure that before that gets into the pool that federal government quotes, some will get into it, some may not even get into it. So I feel that it's underreported. We actually have over 20,000 already. I think numbering up to 23,000 or thereabouts. So, and it's going to get worse, especially with the attitude of Nigerians towards it. Like I used to tell people, if you want to know the person that know another person that know another person, you do not need to just contract it. I'm just joking. But I can, if you wish to see, if you are in doubt, that people are dying, I think you can contact me. It's illegal, it's unethical to begin to mention names, of those that have died of it, of those that have contracted it, of those that are asymptomatic. But I assure you that I see them every day. I deal with them every day. I met, about 2-3 doctors today who tested positive. I've received calls of, of people who have received results, of those that are even symptomatic, that we have had to tell to go and run tests, and they came out positive. So if we are looking for somebody that knows and know to that, you do not need to travel far. Come to LUSUTH and I will show. I will be able to prove it. And then let's get the person tested. If probably the person may not need to know the person that know anybody. Maybe the person himself may test positive, because of the attitude of Nigerians towards this thing. Let me say this. I was in the UK in January, and I came into the country in February 6th. And as at that time, there was no single case in UK. And I remember that on the 6th when I was supposed to board a flight from Heathrow Airport, and I saw Chinese people, putting on face masks. It's kind of odd. They wanted to board with me, but because I know these things, like even before COVID-19, I'm in medical microbiology, and I know these things. I know coronavirus exists, even before now, even before this strain. So I know. So one of them wanted to sit beside me. I was like, I don't have a face mask. What do I do? I was scared. But all other people were just like touching, greeting, and they don't care. But do you know that we have over if I'm not exaggerating, I think over 20,000 deaths already in the UK, and it's going to get worse if the same attitude is applied. So I'm hopeful that Nigeria, will not, will not be nonchalant to the extent that we will now know somebody that dies, of it. Let us know. We know. I mean, as health workers. But when people now start dying by the street, by your street, then, we don't want that to happen. Then people will not be able to deny any longer. And we don't want it to get to that level. It doesn't need to get to that level.
Doctor, listening to you now, you are already frightening me. You're making me believe
that is not my intention, though.
You are making me believe so much that coronavirus actually existed. But I will try as much as possible to talk to you like everyone on the street there who still do not believe that coronavirus exists. Then now let's look into, because our topic is on the health sector, let's come a little bit near that. During the spike, coronavirus here and there, the amount of money you hear now is no more in millions. Everywhere, billion, and billion. I want to also believe that means coronavirus is very expensive to manage. What do you think? Is it that expensive that you need to spend billions upon billions upon billions to manage this pandemic? Kind of. Is it that expensive, sir?
Please, can you quickly brief it again? I didn't hear the last part of that. Please. Can you say it again? Can you ask the question again?
Okay, I said, since the spike, the amount of money you hear are now in billions and billions and billions. Is coronavirus that expensive to manage?
Well, okay, I want to believe so, because even in other climes, in developed climes, they're talking about trillions of billions and trillions of dollars and pounds, and I think that to manage a case, for example, to make a diagnosis of COVID-19, I laugh when people started making jest of the fact that the Commissioner for Health in Lagos came out for someone to come out to say 40 to 50,000 per test. He wants you to query him. He wants you to he's being plain. There's nothing to hide. And I think that that's a good thing for Lagosians to applaud. I should confess to you that it takes a number of things to do for you to make the diagnosis. The material itself is quite expensive. The reagents to use and the rest of that. And in all, it is estimated that 40 to 50,000 naira will be spent to make a diagnosis, because the diagnosis we rely on here is the gold standard. It's not the testing kits, the test kits that are available in some climes. This one is PCR, is molecular diagnosis, and it's quite expensive. Apart from having the machine, the equipment for it, you need to have reagents, you need to have transporting medium and the rest of that. So it's quite expensive but it's the gold standard for diagnosis of COVID-19. We don't want to risk the life of people. We don't want to have plenty, a lot of false negative or positives, or you understand. So what we use the gold standard is the gold standard. You can check the books. It's the gold standard, it's molecular diagnosis, and then it's quite expensive. So diagnosis itself is expensive. The drugs, they use, is quite expensive, and you are going to anybody in isolation. People have given testimonies. The government will feed. Government will provide all the other supports. All the feeding, and all other amenities in there. You're not going to pay a dime, to be treated for COVID-19 in our isolation centers. So it's quite, a huge task, a huge expenses, on the government. And I hope the government can continue. So, to answer your question, of course, yes, we should be talking in billions, of naira in Nigeria to manage, successfully, to be able to manage successfully COVID-19.
Sir, I was listening to a live broadcast, an interview with a state governor in the western part of this country. And, in part of the discussion, I will want to ask you, because this is Lagos, what he said about the amount of money they are spending in their state on managing COVID-19. And this is the style they are doing over there, that they adopt over there, is that instead of going, because he says somebody actually asked him that, why are you not building tents in the stadium? In Lagos, they are building tents in stadium and in bigger spaces. Why are you using it to refurbish or build hospitals, renovate hospitals for isolation center? Now let me now bring it to Lagos. In Lagos, our own style is you build isolation centers in spaces like stadium and all that. And I was in a discussion with some people, and what we concluded is that, do you know that money, the whole of money they are spending on those facilities, immediately after the pandemic, the money or the facility will be pulled down. Since it's a test, they can't leave it there anyway. Why not use that money to improve the health sector instead of using it to build a tent and a temporary facility outside the space of the medical place? What do you see to that?
I share the same sentiment with you, actually, because we should try and, after COVID-19, what happens? We may have another issue on our hands. So, but I think Lagos State is trying to, what Lagos State is trying to do, they should do more. I agree with you, they should do more. I'm not here to defend the government, but if you go to IDH in some 7-8 years, was something that we were not proud of as health workers in Lagos. But if you go there now, structures everywhere, structures newly built.
For our
IDH is mainland hospital, infectious disease hospital, IDH in Yaba, Lagos. That's the main, like the epic center of treatments of COVID and other infectious disease. Before COVID-19, that's the place they treated, they admitted and treated some patients who contracted Ebola, if you remember. So
yes,
aside that, they have chest clinics, they have TB, and other infectious diseases being managed. They usually have their clinics, but we were not proud of it. But if you go there now, I go there every day now. If you go there now, you see buildings. You'll be proud of Lagos. And that's what I expect. Why can't we have something like that every local government, instead of building temporary structures that, like you said, will be pulled down later? And this thing will cost several millions of naira. Why not let's build a permanent thing that will still be useful even after COVID-19? So I agree with you, and I share your sentiment that we should, the government should do more in building permanent structures. I think Lagos State needs to do more. EFCC donated the building very recently to Lagos State. I think somewhere in VI. If you have people donating, use it as, although there are other considerations. Anywhere you are going to treat COVID-19 must be where residential area is far. Residents are far away from. So that there are specifications so that you won't spread COVID-19 to the neighborhood. However, Lagos State should look more about at least building the kind of structures we have in IDH, every local government, so that after COVID-19, it will still be there. I don't want to, venture into trying to defend government. Some governors are doing well, some are not, and I must confess to you. And it is alarming. It's not encouraging. Why? Because if Lagos State is doing well, and Ogun State is not doing well, it will affect Lagos State. We have a porous border. People will move from one state to the other unchecked. So, and I'm not saying that Ogun State is not doing well. I'm just saying that, you know, all states must be on the same page, must do well, so that we won't have migration of um, people with living with COVID-19 from one state to the other. So, but in terms of what they spend, you know, they should be transparent. We should be able to say to the public and defend what we say. You know, I think that, and the populace also, we voted them into power, so we should be able to ask questions. Why is it so? Why not this? You know, like you said now, I guess nobody has told them that building temporary structure does not make good sense, actually. Even though they have, you know, a good mind, those in Onikon, most of them are not sick, but they want to just provide a space for them, you know, keep them for a particular time, until they become negative, and send them home. Some of them are asymptomatic, you know, but they don't want them to continue to spread to people, and that's the reason why they do that. But let's build permanent structure other than temporary structure.
Sir, when you talk about some states not doing well, why some are doing well, you know, what actually came to my mind is that, is there no, you know, let me even talk the Lagos style. Lagos generally, for the general public, is known as a state that are not always a open book when it comes to finance. You will not get any direct open, you know what I mean. There is nowhere you can read, okay, this is how they've spent, this is how they've not spent when it comes to finance. And there is this dicey issue on the street of Lagos about the hype of the death rate that happens sometimes in Kano State. And there was this debate: is it actually coronavirus or not? You know, as an in-house person, was that death, was it coronavirus?
I'm not going to say for sure that it's coronavirus, but my answer would be that we lost 10 professors within the space of 20 days in Kano. That wouldn't have been malaria, as speculated. That wouldn't have been malaria. You know, malaria would not kill an adult. I mean, 10 professors, you know, in 20 days. You know, and I wanted to follow up that report, but unfortunately, you know, everything will be children in secrecy, because what they should have done is to do the postmortem, you know, and be able to identify the cause. If not for coronavirus, whatever will keep 10 professors in 20 days need not to be left, you know, unraveled. But I feel strongly that is probably coronavirus, and the Kano State government was trying to downplay. If you remember that Kano was one of those that did not order lockdown. You know, they were still living in denial until people began to die, you know, mysteriously. So, and those deaths were not even recorded as COVID-19 deaths, but they are mysterious deaths that needs to be. But I think, if you, my personal view, those cases were likely going to be coronavirus. You know, they were just, Kano State government were just trying to downplay it.
Okay, sir, now also talking about some states doing well and all that, let's now bring it to the nation as a whole when it comes to doing well or not. You know, we've known our society or our leaders to be this type that do travel for health tourism, medical tourism, like they call it. And when you look at the rate of deaths, like I said in my introduction, some people actually see this virus as being a big man disease. Some, I even had somebody saying, me, we never even get visa to travel abroad. How coronavirus will happen for abroad to come catch me? Never. Anyway, that's by the way. But, you know, we've known our leaders to as being those who like traveling abroad for medical tourism. Now, looking at the number of people or the number of their class who are dying of this virus, because anyway, the report is they die of coronavirus. Who are dying of this virus? Can you say, because people are saying that it is because they did not take care of the health system and they don't have the opportunity to travel abroad, that's why they are being punished of this disease? Is that your theory too for it?
No, but we have over 100,000 deaths in the US. So nobody will, I mean, they have their own problems now. So arising from COVID-19. So they are not even, the impact on their health is so huge. You know, I'm sure that it won't allow people to come hurt their holes. You know, and if our leaders are not learning from this, it will be a shame, a great shame. You know, a state governor said lost one of the government officials, and what he said is, if not for the fact that there is travel restrictions, this person will have been flown abroad. It's a shame, you know. In the developed world, you know, that person should be meant to resign, you know, the office. Is a failure of that government. Why will you say that? Boris Johnson had COVID-19. He was treated about 3 blocks away from his office, you know, by, you know, the system that he built or they built, you know. So, but if you have to be flown abroad to receive medical attention, then I wouldn't say, I can't say that to the death, you know. I'm not God, but I will have to say that the person deserves to die, you know. But I hope that leaders learn from here. Thank God that you know, we are in it together. We say we die here. So
Yes.
if you don't fix it, something else will happen later in future. So I hope they learn and they start building the structure, those health systems. How do you imagine that even in the midst of COVID-19, when people are dying, there's still a budget of some 27 billion, which was now has been reduced to 12 billion to renovate National Assembly. And in that, you know, do you know how much impact that we have on our health sector? You know, I think this is a misplaced priority, and I think that, you know, if they don't learn now, they cannot learn never. They can never learn, and I hope that we don't suffer it from their selfish, thinking and selfish interest, which they are kind of displaying.
I really wish too, like you, sir. I wish they learn. But if you are just joining us, this is Let's Make It Unfair, and we have been talking to a very learned and experienced person on the matter of discussion for today, which is the impact and influence of coronavirus pandemic on our health sector. Please don't worry, you may have missed some part of the show, or you can as well watch the recorded version online later in the week, and you know, take those parts that you missed. But you can do yourself a lot of good by sharing this broadcast so that you can reach out to so many friends who needs to get information about what the pandemic really means. And I've been talking to Dr. Segun Alli, an in-house person who currently serves in LUSUTH and manages in LUSUTH. Okay, thank you, sir. LUSUTH and manages this pandemic right there in the heart of Lagos. Sir, thank you so much for being part of the show. So, sir, let's continue our discussion, because we actually have a lot of things to talk, and I wish we have enough time to do that. Let's take this conversation to another level now. Sir, aside from coronavirus killing and all that, there are so many people dying because of, maybe you say, negligence or ignorance or what have you. Do you know that people have stopped going to the hospital because they say if they go, you say they have coronavirus? What do you think about that?
I think that any health facility that does that needs to be closed down. You know, in LUSUTH, for example, the people that are admitted for other conditions aside from COVID. It is only when they suspect, and I can tell you that it is not everybody that comes to LUSUTH that will be suspected to have COVID. They are admitting, emergencies are admitting, I'm not sure if the clinics are open now, but there are other health care being given, and I can tell you that unless they suspect, and how do they suspect, of course, this is the right time to have a high level of suspicion, but if clearly you do not have those symptoms, nobody will label you as being. But if you display any of those symptoms, especially now that people, if not diagnosed early, may die. It will be unfortunate if you now go to a health facility and they can't make that diagnosis until it is late. So I can tell you that some people have that notion, but it is not true. However, if you have people that are not living up to the standard, the expectation, and they have to label everyone COVID-19, then it's got to be escalated and taken and taken to the authority, because that will be so wrong. But I can only speak for where I know, where I work.
Yes,
but I don't know what happens to others.
Yes, actually, because I'm also biased, I'm not really falling for your response, because people will still insist that when the reason why they don't want to go for medical checkup or treatment or whatsoever in the medical facilities is because when they go, they will say they have COVID-19, and people are dying, sir. People are dying because of this.
I agree with
you. Let me now ask. Okay, so go ahead, sir.
Well, I wanted to add that, like, I know of private hospitals that will want to know your status before they come, probably because, like I said, this is much more difficult than all other viral hemorrhagic fever or some other viral diseases. Why? Because this one, you do not need to have symptoms to transmit. Ebola, for example, Ebola, yellow fever, all others, you need to have symptoms. You need to be sick to transmit. So it's easier for people to see you from afar, see that you're sick. But this one is quite different. It's like HIV, that you may not be sick. It doesn't mean that you don't have HIV. So this one, you may not be sick. You may have coronavirus. So you may not even show any symptoms. So even to the health workers too, is kind of confusing. And don't forget that this is a novel disease that people are now, getting to master. But before now, no one knows for sure what the real symptoms, and you can only speculate based on what you've heard. But now there are researches ongoing that will try to educate people more, so that when you are equipped as a health worker, then you can stick your neck to say that, oh, this is not COVID-19, and start treating. But until that happens, let me remind you that we lost a doctor in LUSUTH very recently who did ECS, cesarean section for a pregnant woman. The woman did not demonstrate any symptoms. The guy just did the CS, and that was all. He contracted via that procedure, and he died from it. So you won't blame health workers who are cautious, because of the kind of dynamics that we do not know yet about this. However, like I said, with proper provision, with adequate provision of PPEs, we usually tell our health workers that you just protect yourself, but you must, do the needful and attend to people and not label everybody as COVID-19 patients.
And sir, there is another dimension to this question. Normal, we know that for sure. And I want to actually talk on that, because people will take their patients or their relatives to use patient anyway, to take their relative or family member to the hospital. Even when on emergency, they will leave them in the car or in the bus and first be asking them to come and collect card, or maybe say, wait, even with that anxiety, bringing somebody to the hospital for medical attention, there is this attitude of just people should wait, don't rush us, you know, let us take sample and all that. Before you know it, people die, they lost their rate. And now to coronavirus, there's this news also on viral that when you even take somebody for medical attention on emergency too, they will still want to first confirm corona or no corona. They will leave the person in the car. There's a video on the internet of one man who lost his relative, maybe I guess his wife or something, that he drove the wife to the hospital, and there was this normal style of negligence, and people should just wait. So, sir, why is it always like that?
I would say it's a failure of the system, and I'm not going to situate the blames mainly on the health workers. Some health workers, you know, but the system itself, you know, if I have proper adequate PPEs, if I have the proper PPE according to the risk assessment, I will do my job. But if I have to manage, if I don't have what I need, you know, I don't want to contract COVID-19. However, you know, people will say that you are a soldier, so you can't run for war. But if you remember that if you die in the war this time, you know, there is nothing to fall back on. Do they have life insurance? You know, why will you know, in other climes in the UK, like I told you, if you see, they are well appreciated. Apart from the monetary reward, you know, you go to every hospital and they clap for you. I mean, people, you walk past your street and people are clapping for you because they appreciate what you do. You know, we got discouraged. You know, we get discouraged every time. You know, by even your neighbors who will feel that you are one of those that kill people. You know, but it's a failure of the whole system, and I feel that, you know, there should be a holistic change, you know, in the health sector. And I think that all things will begin to fall into place. I'm not holding forth for any health worker. You know, there are people with those kind of attitude, you know, that, you know, but in all, the system is faulty and needs to be fixed. So the government, the health workers, the system generally.
You know, this your reply as actually will bring me to the next question. When you talk about the system being faulty and needs to be fixed, Nigeria does not really have, I'm sorry, but that's my opinion anyway, Nigeria does not really have a proper working system that helps our nation to run like a proper organized nation. What do I mean by that? You know, looking at this season, sir, this season, the people who are supposed to be the most catered for, taken care of, you know, even pampered and all that, are the same people going on strike. Now, let me bring in this strike matter. Why are you people, why are you clamoring for strike? And because one of the things that we hear on the street of Lagos, one of the things that people complain about is that with all the billions of naira on this COVID-19, these same health workers still want to go on strike. So, sir, are we the one missing it, or what's happening?
Okay, it's quite unfortunate, you know. Nobody wants to neglect his line of duty. I'm not speaking for a number of people, but I can speak for myself and some of the people I know. You know, and it's unfortunate when we have to go on strike, you know, at times. You know, and if you look at the last strike action by National Association for Resident Doctor, NAD, you know, the front in row was the issue of PPEs, personal protective equipment. If I don't have tools, what would I work with? You know, that is enough to go on strike, because I'm going to endanger my life. I'm going to endanger the life of a patient, because you never can say if I have coronavirus, then I'm going to transmit to my patient. So if I don't have, you know, basic PPEs, then I can't work. So that's, I think, one of the agitation is personal protective equipment. Now, aside that, you know, you need to when you hear government say 400%, hazard allowance, you feel that is 400,000 naira. But the truth of the matter is, before COVID-19, we had 5,000 naira in Lagos as hazard allowance. And after the 400% in quote or whatever percentage, there's an additional 20,000. That makes it 25,000. In the UK, all doctors, if I quote correctly, that are involved, got an increment of about 100 of about 200% of that, about 100% rather, of their salaries. I'm talking about not the basic salary, everything. For those that probably earn, 2,500 pounds, you get about 4,500 or 5,000 pounds. That's enough enough compensation, kind of, apart from the life insurance. I told you about a nurse that died in last week is there a life insurance for her? Those are the agitations of health workers, that if I'm going to if I'm sure that my family will be well taken care of, I can go face the wall, and if death is, the reward for it, so be it. But the people you leave behind will not suffer. So those are the agitations, and why we will not go on strike for that one if they are not provided. But the insincerity of the government is so much that people rather, believe the government than the health workers. But I can tell you that they will continue to go on strike if the demands are not met. Common PPEs, this is not the right time not to provide.
Wow. First, I need to apologize to my viewers that we are supposed to have another guest from the United States who we've introduced, like broadcast, has been part of this program. And because of what Doctor just said, Nurse Adekanyinsola, she opted out. She said she won't be free today, but she pleaded for Monday night. And I want you all, our viewers all over the world watching right now, please, you can as well join us on Monday night, and we have this kind of conversation with Cookie, and so that we can hear our own side of the story, because she's a nurse and she served abroad. Now, so because I'm beginning to feel, Doctor, I'm beginning to feel like, is this for real? You guys are the main people now, and everybody is looking like, even in the church, there is no section of, there's no program that we have in the church now that we don't pray for health workers. If the church all over the world, in the devotion at home and families, to pray for health workers, if we have prayed so much for health workers, then we still feel that the government too should take you as serious as we see this pandemic. So now, why the package about the pandemic and no seriousness about those who are the main guys managing the thing? Why?
I'm not kind of surprised, the attitude of our government towards things that do not directly benefit them, but like I wrote in one of my books, I said that, it's the fault of every Nigerian who would rather vote for people, not based on what they can do, based on, person no person or the most popular. I rather not vote for anyone if I know that the person does not have the capacity to do well. It's our fault, basically. So we hope that we will learn from it and then be able to ask right questions, not when people start distributing one bag of fries and you sell your birthright and you regret for 4 years. We should ensure that we do the right thing by putting the right people in office. However, I'm not going to say that it is entirely all the governors that are doing that. We have governors that are really doing well, that are, because you have to consider that they have other things to do apart from health, to stick it up for. They have to pay salaries for other health workers. If, the economic impact will be so great, people are poor, people do not have food to eat during the lockdown. And I expect that there will still be monies released to cater for all those. So I'm not going to, some governors are doing well, but most governors are not doing well at all, in terms of that. So, but basically, we like your prayers, and I like prayers and I appreciate prayers because prayers, are necessary. But
Okay.
beyond prayers also.
Sorry, let me hold you there. We have a caller, and he will want to ask his question. Please, can you go on? Good evening. We can hear you.
Good evening. I can hear you. Good evening. Well done. You're welcome.
Okay, go on.
My question is, I want to know if the doctors, they have major complaint, is it for PPE or the money? What they really want? Because the government are saying they provided PPE, they paid as an allowance. Now the other part, the doctors are saying they don't pay PPE.
I can hear some part of it, but not all.
What are they claiming for? Is it for the PPE or the money? What are the government not giving them? Let me not give them.
Thank you so much, sir. Okay. He said, what exactly is the doctor's complaint? Is it the PPE or their money? That there was a time the government said they paid hazard allowance, and later the doctor said they've not paid it. Now, what exactly is the complaint of the doctors?
Okay, I think it's not, it should be all encompassing. It's not just about, the first and most important actually, is PPE. Nobody wants to die. The PPEs are not enough, are not provided in the capacity that you can say that, okay, you can work a week without a shortage of those PPEs. So hospitals, there are lots of hospitals that will still, we have our doctors, we have our nurses, we have other health workers that they still have to do with a PPE for a week, for 2 weeks, and the rest of that, which can actually still make them contract such this disease. PPEs are major, but we still have other challenges. If a state is telling you that they pay hazard allowance, you want to ask for, how much that accounts for. If my hazard allowance as I speak, is 25,000 naira, it used to be 5,000. It was paid only in April by Lagos State and stopped, so I was not paid in May. I was not paid. So why wouldn't I go on strike? And then to the whole world, they've paid, and you think that is a continuous thing. They just pay for April and they stop until, the doctors have to go on strike and they started paying again. So the insincerity of the government is what is being shown displayed here. If you want to pay and continue to pay. We know this is even minute. This is small compared to what we want, but let it be consistent. Then they won't have justification for going on strike. Imagine if you have to work yourself out. When people are on lockdown, we were working. It's not that we were playing. We were working. I was working. And no kind of compensation. Just April, and it was removed. So all encompass. There are some other issues. For example, you mentioned yourself. Agitations that there's no standard hospital. Those are part of our agitations also. But basically, provision of PPEs is inadequate, is not enough. They should do more. Then hazard allowance and life insurance, all those are agitations for doctors. And I hope you know that if any doctor or nurse dies, there's no life insurance for us. And that's so what will my family fall back on? If you want me to go to war, and I have children also that may suffer if I die prematurely.
Wow, this is touching. But there are I guess when the only way to get these things done when the union are up and doing kind of work. I want to believe the unions too are strong, doctors.
Yes, they are. But health worker unionism is not. There are restrictions. You are going to weigh that side by side with your allegiance for the job, with your oath, on the job. So sometimes you want to just let it go, and they've taken us for granted for a long time. The unions know what to do, but most times, strikes are supposed to be the last thing that you think of. Nobody wants to negotiate with you until they hear you've gone on strike. And that's what I do. Let us sit down, let us talk about this. Make more promises and keep to your promises and fulfill those promises. And nobody will want to go on strike. I like my job. I don't want to go a day without doing my job, according to the rooster. So, but do your part. Let the head workers do their part.
Now, sir, we also have a question. Somebody actually sent this question during the week, and I want to also address that. Now, coronavirus is all over the world. Everybody's talking about it. Nigeria too is doing their best to manage it. One of the questions somebody asked in the week is that, what if, with the attitude now, what if there are more deadly virus that will come in the nearest years? How are we even planning to manage it with this our attitude to coronavirus? How? Because there's this gist that there's another more deadly virus coming and all that. Are we actually planning ourselves for something bigger or more worse than this?
No, I think Lagos State has improved over the time from when we had Ebola. Like I said earlier on, IDH Yaba, the infectious disease hospital, like Yaba, used to be a place we are not proud of. But now, it's not just about coronavirus. I think they are thinking ahead. And if you go there now, if you visit, you see structures, good structures, things that they are supposed to have done, but they are doing it now. So I think it's in preparation for, we are not going to pray that something like that will happen. But if it does happen, I think Lagos State will be at least better equipped than what it used to be than now. And I want all other states governors to emulate Lagos, begin to do things permanently in preparation for what may come. We don't pray that they come. So I think that Lagos State is learning greatly. They should do more. There is room for improvement. I'm not praising them. They should do more. Lagos State should do more. It's a center of excellence for crying out loud. But with what they've done, I think they are looking ahead. I think they are looking into the future and are trying to prepare for, a worst case scenario. And I think that we should give them kudos.
Wow, that's a big one. I join my voice with the voice of the doctor, say we give kudos to the state government and the state governor too for a wonderful job well done. But sir, we've passed the mark of an hour in this discussion, and it has been so much insightful and educative, and because there are so many questions that we still need answer for, but because of the time and because of so many people watching us, we are supposed to manage it and maybe wrap everything all off. But sir, I want to say from my end and from feedbacks that we're getting all around, you've done so well to give perfect, let me just use wonderful answers to so many questions. I want to appreciate you so much. You are a shining light that when we see and listen to you like this, we are rest assured that, well, if we have somebody like this in that kind of environment, that means the society is safe. So I want to say thank you so much for this, your time that you've allowed us, and you've used to bless so many people outside there. But before we close the show, I want you to actually put an icing on all these issues that we've been talking about since. First and foremost, what is your advice to people who have stopped going to the hospital? When they say, if I go, they will say I have coronavirus. What do you say to them?
I think that if you have, you should not be scared to go to seek for help if you need one. And I'm not sure that anyone will want to label you. But if that is the case, and you're not sure of it, because there's room for you to query and seek another opinion. And I want to say this to people that no one is. There's what we call quality assurance, quality control. That whatever you buy you know, to use for diagnosis. You test, you know, with a known result, you know, and be sure you are going to be, you have to be sure about the efficacy of that reagent, of that instrument before you use them. That's what we call quality control. And I think we do it in Lagos, and all the results that have come out positive are positive indeed. All the ones that have come out negative, and I must tell you that it's not all results that have been. We have, as a matter of fact, because I'm involved in the diagnosis, I take sample, I know, and I have people that run the test. You know, I can tell you that it is just only about 20 to 30% of even suspected case that we see symptoms that are positive. You know, all of that have come out negative. So the issue of everybody that tests must be negative, I can tell you for sure, because I'm involved in it, that it is not true. So COVID-19 is real. Let us keep safe. Let us listen to appropriate authority. Let us believe it. Let us be able to broadcast to people that this thing, because if you don't care about your neighbor, can infect you. And then people have died, people are still dying, and I hope the death will stop of coronavirus.
Amen. Amen. Sir, how soon is this virus leaving? Is it leaving anytime soon, or it has come to stay?
That will be dependent on our attitude, you know, as Nigerians. If you still live in denial, we may have a big problem on our hands. But if you do what others are doing, there's tendency that we will overcome, and that's my prayer for Nigeria.
Oh, this is sir, you're pushing it back to us. Nigeria, as Dr. Segun Alli said, if you want coronavirus to go, it is in our hands. But sir, let's ask you are the expert around this thing. How soon are we getting a vaccine to sort this thing? Are we working on it?
Apart from, because the generation of the production of vaccine is even going to take, if they start now, not less than 6 months. It cannot be less. So in other words, even if they discover it. Did you get that answer? I said
no. You need to take that line again.
Less than 6 months. Okay. I said that we need to, you know. I already said that even if you get a vaccine that can work now, they will need about 6 months at least for mass production of such vaccine, and they are still at the verge of getting the vaccine. So we still have a long way to go. That may not happen, but what we may rely on later is what we call herd immunity, and that can be explained. If a lot of people have it, you develop immunity against it, and that can cut across the population. That's what we call herd immunity. That may be what we may have to rely on now. Otherwise, vaccine production will be cool, will be fine, will be the best, you know, but that may take a longer time.
What about the glamour for traditional medicines? Are you, because you are a English medical doctor, why are we not looking at that direction too, sir?
It is we homegrown remedies are things that I clamor for also. You know, nobody can help us more than ourselves. You know, and we have things that we can use, but you know, remember that you cannot. It's not just about that thing being efficacious. It's also, you know, getting the right dose and stuff, and that is, I think, what NAFDAC is doing. You know, and all other researchers. And by the time, I hope they get their feet together and they refine one so that we can adopt. Otherwise, we want people to stop using things that are not approved. You know, apart from, if you have a leaf, for example, it has so many components. Some are good and some are bad. So, so I don't want us to fall victim of that. You know, let the right authority, the appropriate authorities, do their work. NAFDAC will test, will come out with things that we can adopt. So don't let us use self-medication. You know, it's not just for orthodox medicine that they use. You can self-medicate using the other one, and it's not right. So let us get the right appropriate authorities to do their work. Come out with something for us in homegrown. Then we'll all be happy using it. I'm in support of it. Some will work, some will be with side effects. But let us follow instructions and not just do whatever we like. It can be devastating if you do.
Wow, that's a big one. Okay, sir. Now I want to let me just mention a little few those who have sent in their comments online, and okay, let me show one or two of them. This is from Barney. Barney was supposed to say, "May God bless your handwork."
Amen. Amen.
And we also have another one from Ari. Ari send his comments, said nice one. And okay, Ifeoluwa, ... So I want to appreciate all these guys who have been part of the show from start and are sending their comments, from Ifeoluwa to Bani to Olamide to Ari and all other ones who did not send in their comments. So I can actually see them, but are viewing us. I want to appreciate all of you for being part of the show. And for the past 1 hour, 11 minutes, we've been talking to Dr. Segun Alli, and he's a very busy person. So we appreciate you, sir, for giving us this audience and allowing us to have a chat with you. Thank you so much, sir, for coming on the show.
Thanks for having me. Great pleasure to educate Nigerians. Thank you.
Thank you so much, sir. We hope to have you again and again if the needs be to have this kind of conversation with the general public. We want to wish you a safe working environment. It's a wonderful system, and God's grace upon your life as you go through this risk to save the life of so many. Thank you so much, sir.
Amen. Thank you. Thank you.
Have a wonderful day, sir.
You too. Thank you.
Bye, sir. Yeah, thank you so much for being part of Let's Go OFE today. It's been a very insightful time. I want to appreciate you all. I appreciate on behalf of Nurse Adekanyinsola that she's going to be on air on Monday. On Monday, I will share the time online. She'll be giving us our own view on this pandemic, as how it has affected the health system over the United States of America. And we'll have time to talk to her like we just did with Dr. Segun Alli. I want to appreciate all of you for coming. Let the conversation continue. You can also watch this broadcast, the recorded version, online, on Facebook and on YouTube, on OFE TV. You can as well like our Facebook page, subscribe on our YouTube channel, and share this video so that you can reach lives. Thank you so much. I appreciate you guys. It's been a wonderful time here. Have a wonderful weekend and stay safe. Obey all government laid down rules for coronavirus, and so that all of us will have a safe world to live in. Have a wonderful day. My name still remains Adebukola Emmanuel OFE. Thank you so much, and see you on Monday. Have a wonderful night rest. Bye.